Hello, everyone, and welcome to the 12th Annual UC Davis Pre-Medical and Pre-Health Professions National Conference. Up next is our What is a Physician Assistant workshop presented by Alex Clerfond, an Associate Professor at Touro University, California. Please give a warm welcome for our distinguished speaker.
Okay, good afternoon. I hope you all are enjoying the October weather. So, as my lovely introducer said, I am an associate professor at Touro University, California, which is in Vallejo, which is it's actually on Mare Island. So we have quite a history there. The Touro University does, we have a College of Medicine, College of Pharmacy, a School of Public Health, and a joint physician assistant master's in public health program, and we also have a school of education. So if you have specific questions about Touro, I'd be happy to answer those afterwards. We get a lot of UC Davis graduates in our programs there, so we have a good relationship with our UC Davis students. So I am a physician assistant. My specialty area is internal medicine and infectious disease. I also work in family practice and urgent care, in addition to a full-time teaching load. So right now I'm going to be doing family practice. But one of the things about physician assistants is that we practice in all specialty areas of medicine. About a quarter to a third of physician assistants work in surgery or the surgical subspecialties. And one of the trends right now in physician assistant employment is working as hospitalists. So if people are interested in the more high-tech, sicker patients, working in the ICU, and working on med-surg floors and taking care of patients who are quite sick, then the physician assistant profession is definitely for you because that's one of the trends. At Touro, and I know it's true at UC Davis and many of the programs in California, we're interested in rural medicine. We're interested in serving the underserved populations in California. So we require that our students have demonstrated an interest and have worked previously in underserved communities. It doesn't necessarily mean that you have to have a second language, although that is helpful. It's certainly not required for entry into the program, but we are interested in folks who are interested in working in some of those underserved areas in California, and that's both rural and urban areas. So anyway, what I'd like to do is make sure we have plenty of time for questions. And I'm going to show you a little video, two videos from the American Academy of Physician Assistants. That's our main organization that represents physician assistants all over the country. They do legislative work, they do policy work, they support us with continuing medical education. They are a great and wonderful organization of which I am a member. We also have the California Academy of Physician Assistants. So if you go on the, that's CAPA, C-A-P-A, website, you can find more information about specifically what's going on in California in terms of legislation supporting PA practice. So with that, my undergraduate degree is from UC Santa Barbara. Go Gauchos. I had a degree in biopsychology. I know you have an NPB major that's somewhat similar here. And we do have students at Touro who have come from UC Davis with that major. So it's a popular way of getting the education that you need to go to PA school or medical school for that matter. I also have a master's in public health from the University of Hawaii. And I got my physician assistant degree, bachelor's in medicine, from the University of Florida. Go Gators. All right. So, and if I understand that afterwards, if there are a lot of questions and we go past that, the 3:45 hour, I am happy to be out in the lobby and answer any questions you have about the PA profession. I've been a PA for 17 years. I graduated when there were only 42 programs in the United States, and now there are 187 PA programs. We have 9 new programs in development just in the state of California. So it's a huge boom in the number of PAs that we're putting out, but also there's a huge interest in how physician assistants and nurse practitioners can be the primary care providers in a new healthcare system. So already in the United States, there are more physician assistants and nurse practitioners doing primary care than there are primary care physicians. So we've already tipped the balance, and there's a lot of interest in physician-led teams and using physician assistants to provide patient care in an unprecedented way. So we are here definitely to stay. So if we can go ahead and do the history video.
Puts a burden aside in your heart. Try to keep it from happening.
Born of the compassion and confidence of the military and medical corps on the front lines, and a need for clinicians to serve on the home front. Over the last half-century, physician assistants have offered comfort, care, and hope from the world wars to the war on crime. And in the words of Jennifer Jones,
our PA provides so much more than medical care. She offers them their dignity, and they love her for it.
the PA profession has its roots deep in the heart of American medicine, rural general practice in North Carolina. There, in 1940, Dr. Amos Johnson trains his employee, Henry Buddy Trevor, to be his doctor's assistant. They work shoulder to shoulder to provide care to those in need. As medicine evolves in the 40s and 50s, the demand for physicians grows so fast the supply can't keep up. But by the 1960s, a solution comes marching home. Highly skilled medics and coordinators returning from war looking for work. Dr. Charles Hudson sees the possibility to take them from outside the wire to inside America's doctor's offices. But it's Dr. Eugene A. Stead, Jr. at Duke University who transforms Hudson's vision into reality. In 1964, Dr. Stead coins the phrase physician assistant, and the next year, he develops the first formal PA program at Duke. It's based on the fast-track medical training developed during World War II, and a handful of former Navy corpsmen are the first students. Among them is Ken Ferry. In the words of Ken Ferry, working up a patient in a hospital was probably easier for us than it was for medical students, because we'd already seen so many patients in the military. In 1966, Book Magazine article catapulted the PA concept into the national spotlight. The following year, Dr. E. Harvey Estes takes the reins of Duke's PA program, and on his watch, the first class graduates on October 6, 1967. With thousands of corpsmen returning each year, many more graduates will follow in their footsteps. To quote Rear Admiral Michael Miller, I still feel the connection to those first PAs and combat medics and corpsmen of the Vietnam era. It made a mark. I silently thank them every day for helping me become a PA. From 1968 to 1972, Estes holds a series of groundbreaking conferences that solidify the future of the PA profession. The American Academy of Physician Assistants is officially registered. In the coming years, PA programs spring up across the country, including Dr. Richard Smith's Medics Medical Extension in Seattle. Medics trained and deployed form a portion to rural primary care practices throughout the Northwest. Gino Giannone was one of the early medics PAs. As he remembers it, Dr. Smith knew what corpsmen medics could do and thought the PA profession was a very good use of that experience. In the coming years, as PA programs spread, organizations formed to set standards, to short compliments, and provide certifications for physician assistants. In 1987, National PA Day was established on October 6th, the 20th anniversary of the first graduating class of PAs from Duke, and also the birthday of Dr. Eugene Stead. Over the years, PA career has grown by leaps and bounds. Today, PAs can prescribe medication in all 50 states, and have served in state and national legislatures, and visited the White House to speak on health care reform. In the words of Rachel Starr-Fairley,
Once I became a PA, my life changed. The fact that I have a skill and something I could pay forward, give back, it never crossed my mind to not be of service.
the story of how PAs came to be is one of the great tales of innovation in American medicine. It's a bold experiment that continues to yield new results. But one thing remains the same. PAs still reach out to people in need of care across America and around the world, finding joy in serving others.
Okay, so a couple of things I wanted to point out from the presentation. One is that the idea for an accelerated medical education didn't come with the inception of the physician assistant program. It came from the 1940s when there was a need to graduate a lot of doctors quickly for the war effort. So the idea that somehow we have less education or that we're being pushed to do something and get out there quickly and then we're not as well prepared actually doesn't hold up. They were doing it successfully in the 1940s, and we have borrowed that model for physician assistant education so that we can graduate people and get them out into the workforce with nearly 70% of what you would get in a medical school. Our students get 2,000 hours of direct supervised patient care experience before they graduate, so which is comparable to medical schools. It's not as much, but it's a lot more than a lot of people are expecting. So we do, most programs are about 25 to 27 months. The program at Touro is a little bit longer because we have the addition of the Master's in Public Health degree. But we do 1 year of didactic and 1 year of clinical, but we go through the summer and our semesters are long, and that's one of the ways that we do accelerated education, is that we don't do 3 quarters a year or 2 semesters a year, we do 3 semesters a year. And you go straight through. We often don't have spring break, we just plow through. So we're getting a lot of the same information, just in an accelerated format. The other thing I wanted you to take from the video is that the physician assistant profession is grounded in the military tradition. So we are delegated practitioners, so our scope of practice is the scope of practice of our supervising doctors. And the US military today remains the largest employer of physician assistants. So we need to remember in this time, especially with what's going on across the ocean, that we have a lot of physician assistants serving today and on the front lines. And we need to make sure that we remember that that's where the profession comes from, and that if you have an interest in military medicine, that there are huge and endless opportunities to do so and to serve your country in that way. So the other thing is that, what's the next best thing? In the video, they talked about physician assistants, the initial physician assistants coming into the profession from having been military corpsmen. And there are still a lot of military corpsmen today who come back and are funded to become physician assistants. There is an inter-service program in Texas, but they're also funded through the GI Bill and other funding sources to attend civilian programs. And what's important about that is that the tradition of coming into PA school already knowing something. Our student population is getting younger and younger, but the whole idea about accelerated education is that you have to come prepared. You have to already know how to interview a patient. You have to already have had patient contact and get over your willies about whatever it is. Medical school is a wonderful experience, and I would sometimes dream that I can go back and do that because it sounds so excellent that you would have 4 whole years to benefit being in an education environment. But physician assistants have to hit the ground running as students. And so most programs do require that you have at least 500 hours of direct patient care. So that's not the receptionist, that's more a medical assistant, a phlebotomist, a respiratory therapist, a physical therapy assistant, EMT, paramedic. You have to get in there and be responsible for something related to the patient before you can get into most physician assistant programs. That trend is shifting a little bit. There are programs today that will take students with no clinical experience, but I think they have a tougher road when they graduate, getting out there and learning how to be a physician assistant, because let me tell you, the first day you graduate from PA school and you're out there and the patient is your responsibility is like, oh my God, right? I still wake up at 3 in the morning. Oh my God, did I check that patient's potassium? You have to really maintain your humble attitude towards medicine. So what do you need to do to become a physician assistant? So you need to understand where the profession comes from. You need to understand what level of responsibility is required of a physician assistant before you make the decision that that's what you want to do. So in order to gain the educational requirements, almost all PA programs now require that you have a bachelor's degree. You have a bachelor's degree in the pre-medical sciences. And like medical schools, you can do that any way you want. You can be an anthropology major, and you can take microbiology and chemistry and physics and do all those things. Different PA programs have different requirements in terms of the specifics, but almost all PA programs require that you have a pre-medical background. And each of the, because each of the PA programs is a little bit different, you have to either go on the program website, or you can go on the centralized application service, which is called CASPA for PAs, C-A-S-P-A. And they will have the minimum education requirements for each of the programs listed there. So that's a great resource for folks if they want to know specifically. But basically, you're a biology major, you're a neuroscience major, you've taken microbiology, you've taken organic chemistry, all the usual things that you would do to get into medical school, you're now doing to get into a physician assistant program. And then in addition, you have your demonstration of service. And that isn't all PA programs, but it's many of the PA programs, and it's certainly UC Davis and Touro in Northern California, and I believe Samuel Merritt in Oakland has the same requirement. So you have an interest in working with underserved populations, and now we want you to demonstrate that you're able to do that and that you still want to do it, even after you have been to wherever to do that. And that can be in the state of California, it can be overseas, we don't have specific requirements about what that looks like, but we need you to demonstrate that you are willing to serve. And then you have to, most programs require at least 500 hours of direct patient care experience. They go up to 1,000 to 2,000, so 2,000 hours of direct patient care experience is a year of full-time work, right? So you worked full-time as a respiratory therapy assistant in the hospital, that's great experience. That meets the requirement for most PA schools. And the trend is towards less clinical experience, but not so in the West. So if you're interested in going to school back east, they have some direct undergraduate to PA programs that are developing there, but we're not really in that place here, and certainly not at Touro. We need people who really understand what patient care is about. So the other thing is to understand the level of responsibility that is required of a physician assistant practicing, right? So a physician assistant in the state of California and in all 50 states and most territories has a license to practice medicine. They have a license to practice medicine under the supervision of a physician, and that can be a physician in any specialty. One of the things I think that people sort of don't understand is, well, how do you do 2 years of education and then you have to do everything that the doctor does? So to explain exactly what that's about, number one is it's accelerated medical education. You come in prepared. The University of Iowa actually has a unique program where their physician assistant students sit in the same classrooms with their medical students. Their entire curriculum is based in the medical school classroom with the medical students. At the University of Florida, I did all of my clinical rotations with the third-year medical students, so they're combined programs. So you are getting a robust medical education, right? And you came in prepared. So a lot of medical students come in prepared with some clinical experience as well, but in PA school it's required. So you're right up there with your third-year med students when you're at the end of your first year of PA school. It's terrifying when you go in and you're like standing in the line behind the, you know, the fourth-year resident, the intern, the fourth-year medical student, the third-year medical student, and then there you are on your first rotation as a second-year PA student. You're thinking, oh my gosh, how am I going to, you know, but you do, you know your stuff. You speak your mind, and you participate in patient care, and you get a great educational experience. So you are getting a robust medical education. And the other thing is that once you become a PA, so once you graduate from an accredited PA program, which they all are, you take a board exam. So we have a national board exam. So this is one of the things that makes it different from nurse practitioner. They don't have a national board exam as such. They do have some national board exams, but they don't have a standardized exam. So with physician assistants, we take our national board exam after graduation from PA school. Most programs have over a 90% pass rate because we choose our students very carefully before we accept them. So we know that they can handle the rigor of the curriculum. And so they take their board exam, and then they become a certified physician assistant. So when you are out there in the world caring for patients, the level of responsibility of a physician assistant is to make sure the patient gets the care that they need. That might be in the clinic by yourself doing urgent care at 9 o'clock at night, or it might be with 3 or 4 or 5, or at one point I had 13 supervising physicians that were more or less available to me whenever I was in clinic. So there's a lot of variability or variation in how much direct supervision you would have on any given patient or at any given moment. But it's important to understand that the patient's care is in your hands. You're writing the orders, you're writing the prescription, you're reading the x-ray, and you're deciding what to do. And that, I think, is sometimes a little bit of a wake-up call for folks. Understanding that the patient's care is in your hands and that you have to make decisions. It's not presenting to the doc and then the doctor makes the decision. It's like when you develop your clinical judgment, which takes some time, and it doesn't happen while you're in PA school, it's after you graduate. So close supervision in the beginning, and then more and more you're seeing patients on your own. But when you develop clinical judgment, then you're making those medical decisions, and you gotta go home and sleep at night. And sometimes wake up at 4 a.m. thinking, holy crap, did I check the glucose level, or was he really taking how many units of insulin? So it's understanding that it's that level of stress and it's that level of responsibility. One of the great things about the physician assistant profession is that when you graduate from PA school, like when you graduate from medical school, you are trained in all areas of medicine, right? You're a generalist, right? So as a doc, you go and you do a residency in a specialty area. You might do a family practice residency, you might do internal medicine, you might do surgery, general surgery, you might want to be a cardiologist, whatever. So you kind of, the crossroads comes at the time when you're choosing your residency, or at least the second year of residency. For physician assistants, we then connect ourselves, at graduation we're trained across the board, and then we go and we connect ourselves with a physician who is willing to work with us and train us in whatever specialty they practice, right? So if when I first graduated from PA school, I worked in a rural clinic in Florida for the Palm Beach County Health Department, and I worked in a HIV and tuberculosis clinic. And I was the only Haitian Creole speaking physician assistant that clinic had ever seen. I was a Peace Corps volunteer in Haiti back in the 90s. And so I saw all of the patients who had HIV and tuberculosis and TB, either active or they had positive PPDs, in clinic on my own. And I had to just go and consult when needed. So my learning curve was extremely steep. But I wasn't doing general medicine. I was doing a very narrow area of medicine. So when I came back to California, I worked for CommuniCare Health Centers, which you may know is the Davis Community Clinic, and I worked family practice. So I had to work with docs who were willing to train me up, who were willing to work with me and help me understand about what you do in family practice, how do we do developmental visits with kids, et cetera. So I had had all of that in school, but I didn't have the sort of apprenticeship that is required. So after that, I spent about 6 years in family practice. I worked for Sutter. I also worked overseas in Haiti at the Albert Schweitzer Hospital, and I did general medicine, prenatal care, et cetera. Worked with traditional birth attendants, and then worked in family practice with Sutter. And the docs that I worked with at Sutter, those first, I would say, at least 5 years after I graduated, they taught me medicine. They worked with me and taught me how to be a physician assistant and how to provide medical care. So the idea that you graduate and you're ready to roll isn't really the picture, right? There are also some postgraduate programs that are starting to spring up, and in fact, I would have been great when I graduated back in the day, 97, if I had had the opportunity to study further. So we are in the PA profession developing certificates of added qualification. So you can graduate from PA school, go work in family practice for a couple years, and then decide, no, I want to be a hospitalist. And you can apply to a program that's very much like a residency program. It's a 1-year paid internship, basically, where you you get the same type of education that a resident would get to kind of upskill you to do hospitalist work or to be a surgeon or to do a surgery PA, to do some of the specialty areas of medicine. So those tend to be mostly hospitalist, emergency medicine, and internal medicine. There used to be, and I think there may still be, a rural health certificate of added qualification that was done at a university in West Virginia. So anyway, the short part of that story is that when you are a PA, you are trained as a generalist in your education, and when you get out and you start working, you learn your specialty, and at any point in your PA career, you can switch that up and do something else. And that's not something that any of the other professions do. So nurse practitioners are geriatric nurse practitioners. While they are in school, they're doing a geriatric track. They're pediatric NPs, they're doing a pediatric track. They're FNPs, family medicine, they're doing a family medicine track. Whereas PAs, we do all specialties. So I have clinical rotations in family medicine, pediatrics, emergency room. I spend a month in the OR doing surgery medicine. We have inpatient rotations as well as outpatient rotations. We get electives, so if people want to do orthopedics or psychiatry or et cetera. So we do everything in school, and then when you get out, you get to decide what you want to do, but at any point in time, if you decide you love diabetes and you want to be an endocrinology PA, you just need to find yourself an endocrinologist who's willing to work with you. And having a background in family practice is really helpful for that. All right, so let's see. What type of a degree do physician assistants pursue? So all PA programs in the United States are moving towards, I think we only have like 1% that are not at the master's level. So you get a master's in physician assistant studies. That's the most common one, the MPAS. Used to be a bachelor's. We're just sort of moving towards the master's degree. There is some talk about PhD, but that's been going on for a very long time, and the basic tools that you need to be a physician assistant are tools that you get in clinical medicine. It's not an academic degree, it's a clinical degree. So getting a PhD on top of that is nice if you want to do that, and many PA faculty do have PhDs in other areas, but it's not required, and it doesn't look like we're moving in that direction at all in terms of being a practicing clinical PA. So how does this profession compare to that of a physician? So physicians have a scope of practice that is based on their specialty area and their board certification. A physician assistant's scope of practice is the scope of practice of their supervising doc. So if I graduate from PA school and I decide I want to do family practice, then I go work with a family practice doc, and she teaches me, how to do punch biopsies and how to do IUD insertions and how to do various procedures, sigmoidoscopy, whatever. And then I decide, you know what, I really love dermatology and I want to go be a dermatology PA. So I find myself a nice dermatologist and I start doing dermatology. I cannot do a sigmoidoscopy anymore because it's not in the scope of practice of my supervising doc. So some people see that as limiting. I know in the nurse practitioner profession, they have been very much about autonomy and about having their own personal certification to do anything. What we find in the physician assistant profession is that we don't need an added certification because we have the scope of practice of our supervising doc, so we can basically do whatever it is they want us to do, which is everything, right? So not all docs want you to do everything that they do, but any doc at any given time can tell you to do whatever. And if you have a particular interest in something, a lot of times PAs come from other professions that are not represented well in their family practice docs practice, right? So if I come from, say, athletic training or background, or I come as a physical therapy assistant or even a physical therapist, and I come into a family practice setting, I bring that added value with me, right? So I start to see the patients who have orthopedic injuries, and I see the patients that the doc is trained to see, but I have more, I bring this added value into the practice, and I'm able to see those patients. So that's in the scope, but it's my particular area of interest. So let's see. The benefits of becoming a physician assistant. So most physician assistants, 10 years out, we have 20 plus years of data, we have 30 years of data about what it's like to be a physician assistant and how satisfied physician assistants are with their jobs. And there's about a 90% chance that if you graduated from PA school, that 10 years from now, you are still actively practicing clinician. So that is actually pretty rare. It's definitely not true in the nursing profession. They tend to gravitate towards research, administration, et cetera. But in the PA profession, we stay as clinicians because we love it. We love what we do. So, and the salaries are going up and up. I know when I first graduated, I had the lowest salary in my graduating class because I took a fellowship. I did a National Rural Health Association fellowship, and I made $36,000 a year. So now, the mean salary for family practice PAs in California is $88,000. A lot of new grads are making in the 80s. So lucrative. Not as lucrative as physicians, but you also get the benefit of going home at 5 o'clock, negotiating whether or not you want to take call, working split shifts or sharing your job or working part-time. There's a lot more flexibility in terms of balancing work and family, which is a big appeal to a lot of PAs. And the opportunities this profession offers, basically, the flexibility to do any of the specialty areas at any time during your career, which is a tremendous bonus, I think, for a lot of people, especially if you're like me and you hop all over the place. The other thing is that physician assistants work in all kinds of medical settings. So we work in federally qualified health centers. We work, the majority work for the armed services. We work in private medical clinics. We work for HMOs, et cetera. You name it, there's a PA there. There's a PA on the White House medical team that takes care of the president. So I think they're Navy. I'm not sure, but they're armed services. Anyway, so I would like to show the second video. How much time do we have? Sorry? 9 minutes. Okay. Okay. All right, so I'm going to show the last video, and then we'll have some time for questions afterwards. Okay, so we'll have to do the 2 minutes of questioning.
It's one of the most sought-after professions in healthcare today, and statistics show that since May 2010, approximately 81,000 people are actively working in this field. Physician assistants are a rapidly growing segment of the medical community. Working alongside doctors, physician assistants, more commonly known as PAs, are an integral part of patient care and can be found in every medical specialty.
We interact with the patients in the office, in the hospital, in whatever setting it is. We do the histories, physicals, prescribe medications for them. We discharge someone in the hospital. We work with the physician in the operating room. And we work as part of the team.
There is very little difference between the way a doctor and a physician assistant treat patients because they are educated under the same model and practice as a member of a physician-directed team. PAs are able to perform the majority of the same duties as doctors, helping alleviate physicians' intense workloads. The team-based approach is essential in providing both preventive guidance and quality patient-centered care.
As a physician assistant working in cardiac surgery, I assist the surgeons in the operating room for a heart bypass surgery. As a physician assistant, I harvest the vein out of the leg that we use for a heart bypass operation. If it's a valve operation, I assist the surgeon in replacing the valve. I then take care of the patient in the intensive care unit for the first few hours after heart surgery all the way to discharge.
Because of the heavy physician workload, it is often easier to make an appointment with a PA.
The number of patients that every provider is expected or required to see during the day has increased tremendously. I know that PAs allow for better access to patient care, acute care, illnesses, follow-ups on chronic disease. I just think the need is there and it's going to continue to grow.
As a physician assistant, I am able to spend more time with the patient. If my surgeon is in the operating room for the day, I am able to meet with the patient and their family as they recover from heart surgery, to explain the complexities of recovering from heart surgery, to go over disease management prevention, and to help with the discharge process.
For my practice, PAs are absolutely indispensable. It's like that in cardiac surgery throughout most of the country, but here at Geisinger specifically, we depend on PAs not only for their technical expertise, but because they are in many ways the glue that binds together the entire facility. They serve as almost our detectives, almost the canaries in the mine. They are on site taking care of patients so frequently and in such an intimate way that they are sensitive to subtle changes in patients' conditions well before physicians and other folks ever recognize it.
As key members of the medical team, physician assistants are helping to raise the standard of care across the rapidly changing healthcare landscape.
I think having a national organization like AAPA is extremely important. They are aware of all the changes that are going on and all the changes that are necessary. And I know that if I'm doing my day-to-day activity, they're behind the scenes working for a total PA profession to help keep us going and improve the work that we can do.
The American Academy of Physician Assistants is the only national professional association that represents all PAs across all medical and surgical specialties throughout the country. AAPA works to support this rapidly growing field by offering career guidance and advocacy support to ensure that PAs can practice to the fullest level of their education and training and provide patients access to high-quality, cost-effective health care.
The AAPA, or American Academy of Physician Assistants, helps PAs keep up with this growth through continuing medical education, providing seminars, providing information on a regular basis to help the physician assistants stay updated. We also have several different groups inside of the Academy that help us to keep up. We have advocacy, we have reimbursement, and other things that help with not only the practice development, but also the professional development of the physician assistant.
PAs need to stay in touch with the constantly changing medical landscape. That's why AAPA provides easy access to continuing education through regional and national conferences and connects you with other PAs and experts in almost every medical specialty. AAPA is dedicated to fostering an environment of professional and leadership excellence.
We have a leadership commission that works on developing programs for people who are interested in being leaders, not only on the national level, but on the local level as well. There are commissions and work groups that PAs can be involved in that allow them to learn how to be leaders, and for those people who are already well-versed in leadership, it also gives them an avenue or vehicle that helps them to grow. The AAPA has remained my primary source to keep me modern medicine with regards to managing the best way to manage diabetes, hypertension, chronic blood disorder, all of these things that can affect our patients on a everyday basis.
Becoming a member also gives you a voice in policymaking, as AAPA is a staunch advocate for legislative changes that affect the future of all PAs.
Recently, the Academy has been involved in creating a position within the Veterans Administration that is entitled the Director of Physician Assistant Services. This is a very important victory for the PAs who work within the Veterans Administration because it now will give them a voice in deciding policy and the health care that is being given to the patients that they take care of. The Veterans Administration is the largest employer of PAs in the country. The mission of the AAPA is to enhance the personal and professional growth of physician assistants. It is to provide the resources and tools that PAs need in order to provide high-quality, cost-effective, patient-centered care.
The momentum behind this field is palpable, and the American Academy of Physician Assistants is leading the way to connecting PAs and transforming care. For more information, log on to aapa.org.
So I encourage you, if you have questions about the PA profession, the AAPA website is a fantastic place to go. They got everything there. I guess we have just a few minutes for questions, and then I'm happy to be out in the lobby for until 4 for anybody who has questions. Yes. Oh, sorry, we had one question here, and then I'll go to you. Yeah. Okay, so the question is, can you practice in 2 areas of medicine at the same time, or do you have to go from one to the other and lose that scope? In theory, of course you can. You can do whatever is on offer. You can work in different specialty areas. You would have different supervising physicians for those different specialty areas, but suppose you worked for an HMO and you were a staff PA, and you worked some days in the psych unit and some days in the outpatient family practice unit, then yeah, there's no restriction on that whatsoever. It's just the supervising docs that you have. So, yeah, and now your question? So the question is, when you see a patient and you make a diagnosis and you treat the patient and something goes wrong, and who's ultimately responsible in terms of a lawsuit? 2 things. One is that you have your own license to practice medicine. The physician does supervise you, and so if something goes wrong with a patient, the physician has the ultimate responsibility for what happens to the patient, but so do you. And you do as a nurse as well. So nurses have licenses that are issued by the state. So if you are doing something wrong and there's malpractice involved, your license is on the line as well. The other thing to know is that a lot of people fear, they say, oh, well, that PA doesn't have as much education, so they're more likely to make a mistake. The fact is that the liability in a practice goes down when they have physician assistants, because physician assistants spend time talking to their patients, and it's the rapport and the relationship that you have with your patient that makes you, number one, a good diagnostician, but it also decreases the likelihood of lawsuits. So there's a lot of data out there now about what physician assistant practice does in HMO setting, in family practice settings, in private office settings, et cetera. So physician assistants are well supervised. One of the characteristics of PAs is that they don't go outside their scope of practice, that we're very much part of the healthcare team, and that we ask questions a lot, and we present patients if we're not sure exactly what to do or where it's an unusual presentation. So yeah, but the liability, the malpractice liability goes down when you employ physician assistants in a practice. Any other questions quickly? I guess maybe one more. Yep. I'm sorry, I couldn't hear. So it used to be that we would do board exam once every 7 years, and it's a general board exam, so all areas of medicine. They've just changed now to an every 10-year cycle, but you have to do the same number of continuing medical education credits as your physicians. So in order to maintain your certification, you take a board exam, but you also, every 2 years, you have to have 100 continuing medical education units, which is the same as it is for physicians. What can we do? Nope, okay, I guess we have to cut it off, but I will go out into the lobby there. Thank you very much for your attention.